doctor wants to see here if there is a gland, because I think there's. If have, it should be done separated. Why? Because we have to cut the breast glands.
Ouch.
I know.
Is it painful now? Okay. I know I'm in a good hand. يجنن شخبط شخبيط. موعدي حق العملية تاريخ 25 ماي. طبعا المركز الألماني قاعدين يتعاملون مع أفضل المستشفيات علشان يسوون فيها العمليات. بعدين راح نحط لكم كل الديتيلز from A to Z تستفيدون وايد. Okay, maybe we can do some marks here because I cannot remove it.
Sure. Of course I can explain some things here, but the most important thing that we can define is the women shape. You know, we need to show more the waist, so that's why we have to do a lot of in this area to reduce the waist and make a good shape. Okay, the both areas. Okay, the woman needs to show a muscle here because we have a muscle called obliquous muscle. So we need to show more this muscle here. This muscle can do something like this. Okay, on both sides. Of course, these markings needs to be done before the surgery. Very careful where we take the measures and everything. Okay, and the other areas, it's of course in the top, around the belly button, and here, like a V. Because the women needs to have like a V shape. Okay, with this muscle more defined, the obliquous muscle. Remember that I told you about the rectus abdominis?
Yeah.
They are here, besides the belly button. It's the femur muscle, 6 packs. But for you, it doesn't. You need to be female. You need to be.
And I still have the bone here.
Yeah, and we can when we do a liposuction in this area, we can put more inside, so we can see the bone will be more showy.
Okay.
You know.
Okay, and what about the back here?
The women's complain almost all the time about some fat that have here under the bra. So we can remove the fat doing a basal liposuction in this area, and of course we have to remove the fat from the flanks. You know, there is an important thing about the difference between women from, for example, Brazil and here in our world. The women in Brazil love to have that kind of Brazilian butt lift.
Yeah.
The butt is more projected. But the women here in our world, they prefer to have more rounded hips, you know? So for example, it's very common in Brazil, we do a surgery to remove this side. But here it's the opposite.
It's the opposite.
We can put more.
No, I don't want more.
No, I mean, it's normal to have here, you know? But depends each case. That's why each patient needs to be seen individualized.
You think, do I need it?
No, I think not, because when we reduce this area, we will see your shape. If you put more, it will be a little bit
too much.
Too much. Yeah.
I want to be natural.
And we have to do something harmonic that fits with your body. You know, not to do something over.
Okay.
Okay.
So this is all what I need.
Sure.
Nothing extra.
Of course, we can do here.
I think, see, here it's more than here.
But you need to remember, probably you have a gland here also. You should do an ultrasound to see if you have it. Because it's not just fat. You have excess of skin, but I think that you have a gland. But we have to do an ultrasound.
I'll do a checkup. Yeah, I'll do a checkup. Alright.
Chin, it's a very common complaint here in the Bahrain, you know.
Since 3 months, I start getting this?
There is some procedures that we can do. You don't have too much fat, but the vasal liposuction will be important to make more tight. So for you, it's enough to do a liposuction. But there's some case that the patient have fat, have excess of skin, and even have this muscle here, because we have a muscle called platysma. The patient have this muscle a little bit weak.
Okay.
So we have to do a suture here to make the muscle more strong. The same way that we do in the tummy tuck. We can do here in the gym, to be more flattened. But in your case, it's not necessary.
In my case, it's fine, yeah?
Just basically.
Because when I lose all the fat, I want here to be like flat. I don't want to have the double chin. Can't wait! Let's see on my weight.
Sure.
68 بعد كنت 45. I was 45 before I got pregnant. So after this, we have to do a checkup.
Of course.
Blood checkup.
We need to blood checkup. We need to do an ultrasound, abdominal wall ultrasound, to see if you don't have any problems like hernia. So after that, you are suitable to do surgery.
Okay. Then see you.
Inshallah.
After 2 weeks.
Okay.
See you, doctor.
See you.
Bye bye.
It was very good to see you again.
Same here.